You are live.
All right, welcome back everybody to another episode of Twisted Tuesdays. Today I have a really good, interesting case for you guys. Like I said, we named these Twisted Tuesdays for a reason. As a medical professional and a provider of health services, I get to see a ton of oops.
I feel like we should have a theme song though,
Yes.
like something
like the X-Files.
Yeah, like the X-Files, or like what's that other show that you used to see all the time? The Zone one. Oh my god.
Twilight Zone?
Twilight Zone.
Yeah.
Yeah.
Definitely, these cases can fall within an episode of Twilight Zone, that's for sure.
That's what it feels like.
So today I'm going to be talking about a 72-year-old female patient who came into my office for chiropractic services. And during the initial patient exam, what I always do is take x-rays. I have a real nice digital x-ray system here at the office that gives me the chance to really look at the structures of the body. And when I was working on this 72-year-old new patient, she was mentioning her aches and pains and things like that. And one of her major complaints was her knee. Her right knee was in severe pain all the time. And I read that she had been going to a doc to get it checked out, and they were starting to do injections in the knee to try to save it. And so I said, you know what, let me get my eyes on this and I'll give you my opinion, because I'm all for second opinions, especially when it comes to, possible knee replacement in this patient's case. So as I was setting up the x-ray for her knees, I could kind of tell that she was like, oh, this is going to be a waste of time. I've already seen the professionals. I've already had them tell me, X, Y, Z, that if these injections don't work, they're just going to take and replace my knee completely. And for a 72-year-old, that's a big deal, because our bodies don't respond well to that much trauma. And so I was telling her, it would be important to make the right decision the first time. So took the x-rays of the knee, and then she came back today and we had a great conversation, and it looks like she's going to be able to keep both of her knees. So let me show you what I saw on the exam and talked with her about today. So I started by showing her what a healthy knee looks like. So on this x-ray here, we get to see a nice knee. So this is like a perfect example. So up here we have our femur, which is pretty much our hip bone that goes down towards the knee. And then we have this little bone that sits right on top. That's called the patella. That's your kneecap. And that moves up and down as we flex and extend our knees. And then down below, the shin bone, the tibia, is this bone right here. So we have the femur and the tibia. Now, as you can notice, they don't touch. Okay, bones are not designed to touch each other because they're two very strong. It's like cement, basically. You don't want to be colliding two pieces of cement, because then they fracture and break, right? Same with our bones. So to avoid that impact, we have soft, squishy tissue called the meniscus that sits here on both sides of our knee. So we have two of them. We have the medial, the inside, and the lateral, which is the outside. And those are like rubber erasers, basically, that sit in between the knees, and they're really slippery. So that's why you shouldn't hear noise when you bend your knee, right? And so those menisci are usually what wears out first when people are candidates for knee replacement, right? The soft cushion is no longer there, and so they're going to put in a fake artificial one, okay? So knowing what a good knee looks like, let me show you what a bad knee looks like. And yes, this was a patient of mine, so these are all in-house x-rays. This, as you can see, these knees don't look like those young, healthy knees, do they? Right here is a perfect example of what happens when your little menisci wears so thin that there's no more rubber cushion in between. So this patient is literally bone on bone, right? So taking a look at this x-ray, you think, yeah, maybe a knee replacement would be the best option, because you're past the point of like rehab, or you're past the point of injections, whether it's hyaluronic acid or stem cell. This patient is pretty much, I would say it would be a good idea to get the knees replaced, okay? Again, here on this side, this is the left knee. this one's following suit. So this person would be a pretty good candidate for a knee replacement, just based off of the wear and tear that we see here on the x-rays. Okay? So now that we know what a good knee looks like and what two bad knees look like, let's take a look at my patient's 72-year-old knees. And these are the knees that they were wanting to replace. Ta-da! Okay. So again, this is her right knee here in this x-ray. This is her left knee. If you look, she has really good gapping still in between her femur and her tibia on both sides. She's 72 years old and she has fantastic knees. And I mentioned that we had previously talked about the knees, and she was kind of hesitant that I don't look at it, right? And as soon as this x-ray popped up, I was dumbfounded. I was like trying to rub my eyes, like, what? Like, how can these knees be candidates for replacement? So I told her, I said, this isn't a knee replacement issue. This is something different. And we went and did the physical exam, and I examined her knees and the surrounding tissue, which her docs did not do. They just looked at an x-ray and then started doing injections, right? And so this little ligament that you see, this little white shadow, that's what's causing her knee pain. So she has a medial collateral ligament strain. Which is just a way of saying she strained a tendon and she hasn't taken care of it, and no wonder why the injections, her knee injections, weren't working, because they weren't injecting the area that was needing pain relief. So they were so off. They're so ingrained in thinking one way, and it's frustrating. And she even brought in her MRI report, and this is what they had. This is the information that they had. They had imaging and they had the MRI, and they still were strongly pushing that this 72-year-old get her knees replaced. So on the back of the MRI report, they'll give an impression, and this is the impression that they put. It says mild arthritic changes in the medial compartment of the knee. No acute internal derangement. So the MRI is screaming, there's nothing wrong with this lady. She has a little bit of arthritis, and that's it. Okay? And so we sat down today and we went over this information, and she just started shaking her head like this. She just said, I can't believe how much trust we put in the medical system, and in 10 minutes you showed me everything that I needed to know, and that was 10 minutes that she didn't get anywhere else. So after the first visit,
Sherry says that is completely crazy.
It's insane. That's why I call these Twisted Tuesdays. I wish it was like twisted once a month, or but it happens so often. It's disturbing. Okay, let me get rid of this. There you go. So the good news is with this patient, she's going to keep her knees, and she knows, she's come to the conclusion that her previous diagnosis was way off the mark. And not only do we know just visually and through the report, but I treated her for her ligament strain at the last appointment, which was about Friday. And she said today she went 2 days without any pain whatsoever. And I spent maybe 5 or 10 minutes working on her knee. No injections, no fancy MRIs. I didn't need any of that because I did a proper physical exam. Why is that so funny? It's sad.
You needed to physically examine what was wrong?
Yeah, I touched her knee, and her knee said, ow.
Shocker.
And I said, okay. If it was internal, I wouldn't be able to provoke that pain, right? So it was external, and so I worked on her ligament, and she literally had no pain for 2 days after a 5-minute session with me. And so she came in
her very first
visit, and I was still trying to figure out what was going on, right? So she came in today. She's like, okay. We had the talk and everything, and I said, you feel so amazing just in a half a minute of me just looking at you. Think how amazing it's going to feel after we actually work on it like it should have been. So she canceled her knee replacement. She canceled her PT because her PT, her physical therapist, was going off of the recommendations of the doctor who was wanting to replace her knee. And 2 wrongs don't make a right. So she was saying that she was just terrified because nothing of what they had prescribed thus far had helped. No duh, because it wasn't in the knee, it was outside the knee. And you would think that would be something simple to pick up on, and it's not. And so that's why we have these Twisted Tuesdays. So I'm going to be working on this patient. She has her right knee, and she also has a right shoulder issue that we were able to pinpoint just to a few muscle groups. So oftentimes people, they look for the biggest, nastiest things, because finding a simple tendon strain isn't that glorious, isn't it? And it definitely does not reimburse the same through insurance. So is there money involved in some of these decisions?
Oh yeah.
Money has corrupted the medical system so bad. And that's not me like trying to be preachy. That's just the fact. Money is what motivates a lot of medical decisions.
Doreen Directe Toronto says you are so awesome.
Oh, Doreen, you're awesome. You need to come in. It's been a while. I know you. I remember you. No. So, anyways, I just wanted to share that with you guys. It's a great hurrah for all of us, because people are waking up. 2020 has really kind of woken people up to not blindly following the first recommendations you get.
Which is a good thing.
Which is a fantastic thing. Always second guess me, I don't care. I'll give you all the information I can, and if you want a third opinion, I will celebrate for you. But typically, like the patient we just talked about, once you can show them where the real pain's coming from and you can take it away from them for 2 days in your first visit, that says something. So anyways, thank you guys for joining me on this Twisted Tuesday. We kept 2 knees alive because I know they were going to go after the right one first, and then they were going to probably take the left one as well. For what? For nothing. This lady is in immaculate shape for a 72-year-old. So yeah. She doesn't fit the typical sick American mold, but they wanted to shove her into it real fast because out of sight, out of mind, right?
Seriously.
So thank you guys for joining me this Twisted Tuesday. I'll keep you guys updated on this, but always second guess, no matter what.
And then just like a quick plug, I don't know if you can even see me. Don't forget that we are doing that giveaway, and that will be the last chance you have to enter. That is Thursday evening, so that way we can do the raffle Friday. So it should be the pinned post at the top of this page. It's titled Giveaway, Giveaway, Giveaway. So
Yeah.
That should be pretty simple. Go find it and enter in so you can get some free stuff.
Yep, and then also this Thursday evening, I am going to be giving an in-office talk about autoimmune diseases, which is, again, one of those things that people, the medical field, has really screwed up their perspective on what creates an autoimmune disorder and how to treat it is so backwards, it'll make you upset just to hear the information. So please join me this Thursday at the office at 6:30. Shoot us a Facebook message so we know that you're coming. We're going to have some nice, tasty treats.
We have an event they can go on and register in our events page.
And then on our event page, that link to the Thursday talk will be there. So come out, get out of your house. You don't have to wear a mask. Just come and be a human being for an hour on Thursday night, okay? I look forward to seeing you guys there. All right, bye-bye.